Well, drug dealers have been mixing cheap synthetic opioids into their street drugs for years, making the drugs more potent and dangerous and much cheaper to produce. Last year, nearly 300,000 overdoses were recorded across the nation. About a third of those were fatal. And now dealers are using an animal tranquilizer to bulk up their supplies. Addiction medicine physician Dr. James Besante joins us live. Doctor, thank you so much for being with us. Why is this drug, this xylazine, so concerning? I mean, talk about some of the potential side effects with it.
Yeah, absolutely. Thank you for having me on the show. So xylazine, as you mentioned, is an animal tranquilizer. It's not approved for human use. And we've seen xylazine adulterate drug supplies a long time back. In Philadelphia, there were overdoses related to xylazine as far back as 2006. What has changed is that in the last 2 years, we have seen a dramatic increase in xylazine being found in not just heroin and fentanyl, but other drug supplies as well. It's an animal sedative that, when mixed with opioids, intensifies the opioid high and can extend it for longer periods of time.
So, doctor, looking at our screen right now, we see that xylazine is resistant to the overdose drug Narcan. So Narcan helps stop overdoses. If Narcan doesn't work on this, what does? Does anything?
It's a great point you're making. So xylazine is particularly dangerous for a few reasons. First, it's a sedative. So it can lead to respiratory depression, which can increase the risk of an overdose death from opioids. And what makes the situation worse, if someone was to use an overdose reversal drug like Narcan, naloxone, it has no effect on xylazine because xylazine is not an opioid. So you may reverse the opioid overdose, but the individual may have a lot of a sedative in their system that would continue to decrease their respiratory rate and affect their ability to breathe or their heart to beat and pump blood throughout their body. Additionally, xylazine causes vasoconstriction, which is a big deal and leads to really, really terrible skin infections. And I personally had a patient with both legs amputated, likely related to xylazine infections.
Well, before we let you go, doctor, I mean, you're saying it's a sedative, but again, this is an animal sedative, an animal tranquilizer. How are people getting their hands on this?
So I think a lot of really smart folks are trying to figure out exactly where xylazine is coming from. We do know that supplies for veterinary medicines are not under the same scrutiny as human medications. So part of it has to be, really looking at our veterinary drug supply in a more critical way and securing that supply. But we also know that xylazine is being incorporated into drugs overseas in other countries, as you mentioned, in these clandestine laboratories in places like Mexico and China.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.